Hi, so today we're going to talk about the simple extraction, the simple extraction. So for that one, the instruments that you'll need is the local anesthetic agent setup, the basic setup, the periostall elevator, the forceps, and the surgical curette, the sterile gauze sponge, the surgical aspirator tip. And for the basic setup, you need the mouth mirror, the Explorer, and cotton pliers. So the mouth mirror has indirect vision, retracts the lips and cheeks, and the tongue, and then it reflects light into the mouth. And then the Explorer, it's to examine for decay, calculus, any type of abnormalities. The cotton pliers is to grab or transfer items, material into and out of the mouth, like any type of material. And then here is a picture right here of all the instruments that you'll need. Okay. So, and then for the posterior, for the posterior elevator, it's to separate tissue from the tooth or bone, and to hold the tissue away from the surgical site. And then the elevator, it could be a straight elevator, it could be any kind of elevator that the doctor will prefer, because normally it's up to the doctor if they want the elevator, like what type of elevator they want. So this is your straight elevator, which is to loosen like the teeth and all that. So that's your straight elevator. And then is to loosen the teeth from the periodontal ligaments and all that. And then you'll need your mouth prop, which is to open the patient's mouth, which is this. This is the mouth prop right here. Okay. And then you'll need like the scalpel blade and all that. The scalpel blade is this one. Okay. This is the scalpel blade. It's to hold the scalpel blade is to hold the blade in place, to cut tissues with the blade, and to trim. And then your surgical, and then you'll need like the tissue forceps, which is to hold the tissue during the surgical procedure. And this is your tissue forceps right here. Okay. And then you'll need like a hemostat. You'll need which is this. This is the hemostat right here. That's the hemostat. The hemostat is to grab tissue or bone, like the bone fragments. And then your surgical curette is to remove debris and granulations, tissues from surgical site, to remove cysts or anything like that from the site. So this is your surgical curette right there. Okay, and then you have a tongue and cheek retractor that's in the that's in the tray setup, and is to hold and retract the tongue and cheeks during the surgery, which is this. That's it right there. And then you'll also need the surgical needle holder, which is to hold the needle and is to hold the needle in place. Is to and then you'll need your suture needle and suture, which is this. Sorry about that. I forgot to show you and then this is the needle holder right there. And then that and then you'll need like your suture scissors, which is to cut the sutures. And this is the suture scissors right here. And that's pretty much it for the instruments that you'll need. And then you would have to make sure that you sit the patient down and ask them their medical history, their anything like that, and then you would have to ask them like if there's anything that has changed in their history in their medical history or anything like that. You would have to take their vitals, and then you would have to take all their vitals and stuff. And then after all that, okay, then you explain the procedure to the patient, and then you make sure that with the instruments, you have to make sure that you do not open the instruments before the patient is seated, because you have to make sure that you open them in front of the patient. And then after you have everything all set up and everything like that, and all the instruments are open in front of the patient, then you're ready to go with the doctor, and the doctor will start the procedure. But it's pretty much simple. But you just have to make sure that you have all instruments. You have to make sure that you have all of the suture and stuff like that. But and then and then after the procedure is done, then you do the post-op, which is going to be in my next video that I'm gonna do. And yeah, so that's the things that you need for this procedure, and all the instruments.